Hello, everybody, and welcome to The Better Life with Dr. Pinkston. I am Dr. Mariane Pinkston, and today I've got a great topic for you, something that everybody asks about over and over, but really doesn't understand, and that is allergies and allergy testing. And so today I have a local allergist to San Antonio who's going to sweep this information clean and make it all in a pretty bow for you. And that is John Freiler, Dr. John Freiler. So welcome in. I'm so glad to have you here.
Well, good morning, and thank you for having me on the show.
Absolutely.
And I just love allergy, and I love to talk shop. So
you are very passionate.
So let's rock it.
That's why I dragged you on here kicking and screaming.
I don't think you dragged me here, but I'm here.
It's awesome to have you.
The traffic on 410 dragged me.
Oh, that was pretty bad too. Well, so, let's talk a little bit about allergy, because I think most people are fairly confused about allergies and, why they don't have to sit at home and suffer and take Zyrtec and nasal sprays and things like that for indefinitely daily for the rest of their life, especially in San Antonio. Yeah. It's a mecca of allergy.
No, that's correct. And certainly, the over-the-counter medications and empiric treatment up front, reasonable, right?
Sure.
I have my cat, I pet my cat, my eyes itch. Well, you're allergic to the cat, right? But really, when people have the chronic runny nose, itchy eyes, and don't forget too that this is all one airway. So when it gets into the lungs, the chest tightness and the wheezing, people suffer.
Yeah, they really do.
And they suffer, I'm going to say, unneedlessly.
Exactly. So, when patients come to see me in clinic and they, talk to me about this, want their refills on their medication, I usually introduce to them the fact that they don't have to suffer. There is a way to escape the burden of all these medications, and it's very expensive. And this, as far as, buying the medications over the counter, but that there is a way normally covered by insurance to be free from allergies and asthma and all the suffering.
Absolutely. And, it's interesting. I had a patient the other day post a comment on my Google review and saying how silly she felt, right, of coming to an allergist. She just did not know what to expect. And her comment was basically, why did I wait so long?
Exactly.
And when I read the Google reviews on my website, that's a very consistent theme.
Absolutely.
And honestly, the biggest thing that I do when a patient comes in my door is listen.
Right.
That's number one. Listen. But I get a detailed history. And by focusing on the history, I will then pivot to the person saying, hey, look, let's do some allergy testing. Let's try to figure out what your triggers are. And then based off the testing results, we can either optimize medication if need be. Medicines are often actually not utilized correctly.
This is true.
Optimize cost, right? Generics are perfectly acceptable rather than branded name. And then once we identify the triggers, what can you do in the environment, right? There's very simple things for dust mite, using dust mite bedding products, washing the linens every 1 to 2 weeks, right? Very simple measures.
Sure.
For the pollens, right? Now, you can't go down and, put concrete in my yard and your yard because the pollen's going to come from your neighbor's yard, right? But simple things you can do. You go out and do yard work, well, wear a mask.
Sure.
Now, I know I've personally done it. It is not fun in San Antonio wearing a mask while doing yard work, but it works. You come in, outdoors, wash the lid margins, blow your nose, nasal saline, all goes a long way, right? So we have the identification of allergens, avoidance measures, and then optimizing pharmacy or medications, right? And that runs the gamut from nasal steroids to oral antihistamines as the workhorse, all the way to something as immunotherapy.
Exactly, which is where I would love to concentrate, because I am one of those patients who felt very silly for letting it go for so long. And I, once I received immunotherapy long ago, it was insanely helpful. And I dropped all of my medications for years. And I think it's time to do it again. I
hear you.
Well, but I think patients really are kind of scared of allergy testing. They think maybe it's painful. They imagine needles in the skin and, you know, suffering through itchiness. And that it's not like that at all. Can you describe it for us?
Yeah. Well, with allergy testing, there's really two methods, right? You can do serology or blood testing or skin testing.
Right.
And they both kind of answer the question in a roundabout different manner, right? So blood testing, and sometimes I have to do the blood testing. There's a variety of reasons, whether you cannot stop antihistamines for testing, sensitive skin, chronic hives. When we do the blood test, what we're looking for is the presence of that allergic antibody in the blood. Is it present? Yes or no? And if it's present, how high is it? With skin testing, which is kind of the workhorse of what I do in the clinic, that's more of a physiologic test, right? You put the allergen on the skin, a little drop. We use a skin test device, and it's you'll feel a little poke. It's not painful per se.
It's almost really plastic, isn't it? It's not really needles. It just impresses it in the skin.
There's a couple of different devices. The one we use is plastic based, and there is another one that has small little, they're metal tines on there, but they're truly not painful.
Right.
It's a little bit of pressure. It goes on your back. If your allergy cell recognizes something you're allergic to, it will activate the allergy cell, release histamine, right? And that's the driver of allergy. And it's going to cause small hive,
right? And
it can get itchy in the area. But it's pretty simple. 15 minutes, we know the answer.
Right.
Yeah.
And so then if you're, you know, positive, it measures out correctly and you get the results you need, then how do they enter in? Because there's the other thing. Patients are like, I have to go every week to get a shot, or, you know, kids maybe are frightened of it, and even some adults. And
absolutely. So the term immunotherapy, right? So for the last 100 years, it has been allergy shots, right? And I would say allergy shots are traditionally the go-to. But we also have sublingual immunotherapy these days.
Right.
And we have a couple of different formulations of that. You have FDA-approved allergy drops, or tablets, okay? So ragweed, dust mite, grasses. And then we also do allergy drops.
Sure.
And they can be done at home, no injections, super, super convenient.
Awesome. And is there a difference in who you decide who gets drops versus shots?
Yeah, absolutely. So there's a couple of different scenarios. Allergy shots tend to be more effective in terms of what you can administer.
Right.
Okay. And even just to step back a little bit, what I administer for allergy drops, what you take in a month, is typically what you would get in injections for a year.
Okay.
Right? So the injections are a little bit more efficient in terms of presenting the allergens to the immune system to do the magic. There's a rate limiting factor of what you can really get under the tongue to effectively be absorbed. I try to tap it or cap it around 10 allergens, give or take, but there's no hard and fast. Right? And so, you know, and then for some people, they just can't come to the office. Right. Busy professionals, they travel, and the drops are super convenient.
Right, exactly.
You can travel with them. They don't have to be refrigerated. There's no doctor visits.
Right.
But at the end of the day, they're all super effective.
That's wonderful.
Yeah.
And then you can be free from having to, you know, tie yourself to
about 85% of patients who go on a course of immunotherapy will get improvement. And I'm one of them.
Right.
I suffered for allergies bad. And I did my shots for about 5 years. Right. So an average course of immunotherapy, 3 to 5 years to get. And I refer to the magic of immunotherapy, right? So immunotherapy does a couple of things. It not just reduces symptoms, right? And that's what everyone wants to go, right? I want the benefit. I want to get better and feel better.
Exactly.
And the shots do that. But after 3 to 5 years of therapy, you're training the immune system. So it doesn't recognize those allergens in the future. And maybe you do when you come off a course of immunotherapy, but they tend not to be as bad as what they were.
Exactly. Right? And it lasts for a very long time. Now, I only did that. I did it through an office where they only offered it for about a year's worth, I think, which I think it should go much longer. I think the 3 to 5 years.
It's 3 to 5 years is what's
correct.
recommended for.
But that was the office I went through, but it still lasted me. I know about 5-6 years, and I feel like I still have something left over. I should probably get back and retest and see where I am with that, because even this morning, I feel it. Sure. It's really it really interferes. The thing I worry about though is patients and asthma. So allergies are one thing, but asthma is a very serious animal for patients who, people with asthma tend to live effectively without oxygen and don't realize that they are really affected at work or at school. And that they don't realize they can go and get allergy testing for their asthma and have that under most of the time significant control.
Absolutely. And as I alluded to before, it's all one airway, right? So some people are more susceptible. If you get it up here, it gets down to the lungs. Right. And, so for asthma, you have those with allergic triggers, and there's non-allergic asthma as well. But a good proportion of patients with asthma have allergic triggers. And I have seen the magic of immunotherapy with allergic triggered asthma. Absolutely. A little bit of a double-edged sword though, right? Because you have to have your asthma under control to start or initiate a course of immunotherapy.
Gotcha.
But I have seen an example of grass allergy, right? When I was at Travis Air Force Base, the northern pasture grasses out there, horrible, horrible. And I would have, and I know I had a handful of patients, they were on controller medicines every day. Right. And after 1 to 2 years of immunotherapy, they were albuterol as needed. Right. And really, really
that's life-changing. Yeah. It really is. Yeah. So how young can you treat for allergies?
There's no actually lower or upper defined age. And so when I'm assessing somebody for immunotherapy, it's can they reliably relate that they're having some adverse reaction? Okay. And I would say 5-ish is probably, about the youngest, 6, 7, but it just depends on the child. Sure. And for adults, there's no upper limit, right? Wonderful, it comes down to medical comorbidities. Right. What kind of medical chronic illnesses do you have, and is immunotherapy safe for you?
That's great. And so I know people worry about cost and things like that as well. Right. And so most of the time insurances do cover. We usually do not have trouble getting them to you as far as insurance coverage. And then do you have a lot of trouble with getting the therapy covered?
No, actually immunotherapy is pretty well covered. That's great. As we talked about the different forms of immunotherapy, so the allergy shots are traditionally covered by all your major carriers. Sure. Now, we do live in a world of high deductible plans. Absolutely. So sometimes that comes into play. Absolutely. The allergy tablets, so dust mite, ragweed is pretty much what I'll use down here because the grass tablets are more for northern grasses. Okay. But they're covered by insurance as well, usually under a pharmacy benefit. The allergy drops, because we use them off-label, they are typically cash pay.
Okay, gotcha. And so, we're going to talk in a few minutes about food sensitivities. I know this has been a hot topic in the last few years about leaky gut, things like that. I spend a lot of time on it in clinic, so I know we're going to talk about that. I would love for people to know where they can reach you and look up your information. And so let us know.
Absolutely. So I am on the northwest side of town, Alamo Ranch area, kind of over in the SeaWorld, the 151 corridor. So I pretty much kind of target the Northwest San Antonio area.
Excellent, excellent. So give us website information, phone number, things like that.
Very simple, premierallergytexas.com.
All right. Is it TX or
TX? All right. TX.
And that will be on my website as well at drpbetterlife.com. And you can find all of my previous shows. I think this is number 102. So,
oh, Lord.
I know, it's wonderful.
Well, this is my number 1.
That's done well. And so do you, as far as getting patients in, are you pretty quick to get your patients in?
I am. As a new clinic. So I retired out from the Air Force last year in August 21, and I opened my doors in September 21. So I'm anything but retired. So at this point, we're a new clinic, and I have more availability than I care for.
Right. And well, what I love is the old-fashioned way. You did it the old-fashioned way, and this always piques my interest, where a physician actually comes to my office and asks to speak with me, and my staff gets to know us, and loved that. And so in hearing you speak at the clinic, you are extremely passionate passionate about what you do and extremely knowledgeable too. So that is why we love you. And we send you so many of our patients. I'm out there on the Northwest side too. So love that.
I appreciate it.
Absolutely. So again, we're going to come back on the other side and talk about food sensitivities. I know a lot of people have questions about that. I do need to pay a little attention to my sponsor, which is Pinnacle Research Texas. They are kings of liver research, mostly a non-alcoholic fatty liver research. And they do a FibroScan test, which is free. And that is to look for fatty liver, which is rampant in South Texas. So I encourage you guys to look for pinnacleresearch.com and sign in and sign up for your free fatty liver scan. And that will lead you to a nice, it takes about like 7 minutes. I went and had it done. I got to speak with one of the physicians after, so I got results and feedback immediately. And then if positive, they can funnel you into some therapies and even research, which I think people are a little scared of. But they have some wonderful research opportunities, which afford people some fantastic treatment. So pinnacleresearch.com. And guys, I thank you very much for sponsoring the show. And so in looking at food sensitivities, I know we got just a minute left here, but looking at food sensitivities, again, why is that such a hot topic?
Well, I would say oral immunotherapy. Mm-hmm. The last medical conference I went to in San Antonio for the Quad AI, that's our big allergy professional society, the number of poster presentations on food allergy was exponential.
I'll bet. It is the hot topic these days.
Absolutely.
And it wasn't 10 years ago.
No.
You know, and I think we'll get into this deeper here in just a minute. But I know patients are asking more and more about that now. And so when we come back in a few minutes, I'd love to talk about how this came to be. Why 10 years ago or 20 years ago, you know, you could go to school with a peanut butter sandwich, and now you can't walk into the school with it in your pocket at all, or Reese's peanut butter cup anymore. So we're going to take a minute and come back on the other side and talk food allergens.
Fatty liver is linked to two different situations, alcohol and diabetes or obesity. In both cases, patients can have no symptoms. In the United States, and in particular, Texas, the most common cause of liver disease in general is non-alcoholic fatty liver. Again, associated with overweight, obesity, and or diabetes. Additional risk factors include high cholesterol, high blood pressure, Hispanic ethnicity, and postmenopausal status. At Pinnacle Clinical Research, we offer a quick, non-invasive ultrasound-based screening assessment called FibroScan. This test is done at no cost to you, and we do not take insurance. The test will measure the fat and stiffness in your liver and stage your risk and development of fatty liver disease. You will meet with a provider immediately following your scan to go over your results. If you're interested in getting more information on your liver health, please call 210-982-0320 and schedule your FibroScan today. We are conveniently located in the Medical Center at 5109 Medical Drive.
Welcome back. I'm Dr. Mariane Pinkston here with John Freiler. Dr. John Freiler, I keep doing that to you, sorry. I want to give you all the credit.
Doctor.
Exactly. But we have been talking about allergies and, you know, seasonal allergies and asthma and things like that for one. Right. But again, pressing the hot topic button on food allergies. You know, 10, 20 years ago, we didn't really focus a lot on food allergies. But now, like you said earlier, you went to a conference and this seems to be the biggest highlight now. Why is it that we are having so many problems with our foods?
Well, I think over time, and actually even let's just step back a little bit, right? Mm-hmm. So when we have food allergy, it's very important to, and this gets back to the history, right? What I talked about. When someone comes in my door, it's a detailed history. Yeah. Because in terms of food allergy, we have intolerances. We have food allergy that is mediated by different branches of the immune system. Exactly. So some are what we would call IgG. So yes. Traditionally like celiac disease or IgA with celiac, or IgE, the truly allergic food allergy. So you ingest peanut and within a few minutes you're broken out in hives, you have respiratory distress, abdominal symptoms, and that's what we would call anaphylaxis, right? So When we talk about food allergy, that's something I truly, truly try to break down, right? Or the other common one is milk. A lot of the lactose intolerance, right?
Right.
But
so you can have a lactose intolerance, but a milk protein allergy too, right? And there are two types.
You can, and that's where the history is so important,
exactly.
Right? Because you really have to sit down with someone, get a detailed history, do the allergy testing. And we talked about whether blood testing, skin testing, or sometimes I use a combination of them.
Right.
But the food allergy science has really, really taken off. In the past, it was you are diagnosed as allergic to peanut. It is strict avoidance.
Right.
Strict avoidance. Chance of outgrowing, pretty unlikely. Now, we do know the natural history of food allergy. There are some foods that you're more likely going to outgrow naturally. Milk, egg. And I would say maybe around maybe 10 years ago, the baked egg or baked milk. And what we found was if somebody was able to tolerate a baked egg or baked milk and they introduce it into the diet, that seemed to be pretty reassuring that over time they would likely outgrow.
Gotcha.
Right. And over the last several years, there's been, I'll call it a small kind of focus group within our professional societies that has kind of dedicated themselves to food allergy research. And over time, these protocols for desensitization to various foods has proven to be pretty effective.
Right.
And I will say it's investigational at this point in time, but I think we're hitting a tipping point.
Right.
I truly do.
Right.
I truly do.
Right. And I speak to people often about our gut health because I think that's where a lot of exposures to things like, genetically modified foods and things like that, things our bodies don't recognize anymore because it's changed.
Right.
And then it also crosses the intestinal wall and whatnot. So I spend a lot of time with people on that as well. And I think
the microbiome is huge.
It's absolutely.
I mean, you can't deny the fact. Now, it's still a lot we don't know.
Sure.
But your gut health is key.
Absolutely.
And it changes through life.
Absolutely.
Right? And it changes with exposures. And I think that's a very fascinating field.
I do too. It's one of my favorites.
Yeah,
and
absolutely.
My patients and listeners know that for sure. And so with food sensitivities and whatnot, I know in the past we've had trouble getting that covered by insurance as well. I know people are concerned about costs. A lot of the testing I've had in the past were something people had to pay out of pocket, $400, $800, sometimes even more. So is that better? Does that have better coverage now?
And I would say it depends on what you're trying to test for. So if you're testing for the classic IgE allergic food allergy, it's pretty well covered. And even to the point now where we have what we call component testing. So if you're allergic to peanut, I can break that protein down and look at the subcomponents of that.
Right, and cross sensitivities.
And really get a good idea saying, you're very, very high risk. Maybe we should practice avoidance, or looking like, you may have a good chance of passing a food challenge.
I know that there are more and more biologics used these days. Very, very expensive though, and cumbersome on the medical front of cost and whatnot. Do you often prescribe those?
Yeah, well, biologics have been a game changer. Absolutely,
yes, they have.
Absolutely. For food allergy in particular, that's investigational at this point. But I do think there will be a role of biologics with some form of immunotherapy, maybe as a bridge. You're doing some oral immunotherapy while you're on a biologic.
Right. And by biologic, I mean those that are now, advertised on TV for eczema and asthma, a shot that you take, every couple of weeks to a month or a couple of times a year or whatnot. And so they're incredibly expensive, thousands of dollars a month. Those are reserved, I think, for the very severe.
They are, but they work well.
They do work well. I'm on one for rheumatoid arthritis. And so,
absolutely. Total game changer. Total game changer.
Well, excellent. So one more time, can you give us some phone numbers and websites and where we can find you?
So the easiest one is premierallergytx.com on the web. And you can find us also on Facebook as well.
Oh, good. Excellent. Where do they find you on Facebook?
Premier Allergy Texas.
Premier Allergy. All right. There you go.
Keep it simple.
Keep it simple, stupid, right?
Exactly.
All right.
Exactly.
So, and all of that information I'm going to highlight on the website as well. So you can go to drpbetterlife.com, and I will have all of that information as well as all of the previous shows and previous guests. We are on all of the podcast platforms as well as YouTube. And then on San Antonio Radio at 4 p.m. on Sundays on AM 930 KLUP, The Answer. And so I really appreciate you coming in. Is there any kind of final comments or anything we didn't cover that you would love to?
No, I would just say, why wait?
Exactly.
Stop the suffering, right?
Exactly.
Come visit us at Premier Allergy of Texas, and I certainly guarantee we will give you a very focused history, figure out what's going on, do the appropriate testing, break it down, and develop a very personalized, tailored plan to get you feeling better. I
cannot think of anything better than that. And so my little testimonial is that in the past I had severe allergies, especially in San Antonio. It's just so terrible here with especially wintertime allergens and spring. So cedar. Oh my goodness gracious. So yeah, they call it cedar fever for a reason. But I did real well with allergy therapy. It was convenient and easy and not a bad experience whatsoever. So absolutely, please get in and see Dr. Freiler. And we can, you can certainly, if you go to my clinic, I can certainly do your referrals and pitch you that way. But thank you so much for being on the show.
Welcome. It was awesome.
All right. Everybody have a wonderful week. Thank you very much.